I am Antara Jalila. So my topic for today is about definition of cold liquid diet. So the cold liquid diet is a food preparation that consists of cold or ice smooth liquids in semi-liquids. It's often recommended after surgery to promote healing and avoid irritation. So the purpose is number one, to avoid irritation at the site of the rejection. So number two is to rest and to promote relief to the organ included. So number three is to minimize pain and oral cavity. So the number four is to avoid bleeding or operated area to promote rapid wound healing. So the last one is to replace nutrients and loose and to provide oral source of fluid for individuals who are incapable of swallowing, digesting solid foods. So that's all. Thank you.
So here are the indications for the cold and sea liquid diet. So category, pre-operative, post-operative. So for examples, patients scheduled for tonsillectomy or adenoidectomy may be placed on a cold liquid diet to reduce the risk of aspiration, ensure stomach is empty before surgery. Gastrointestinal disorders, patients with conditions like gastritis or inflammatory bowel disease (IBD) may require a cold liquid diet to reduce gastrointestinal irritations and allow for easier digestion. In medical tests, patients undergoing certain diagnostic tests such as endoscopy may be instructed to follow a cold liquid diet prior to the procedure to ensure the digestive tract is clear. In transition diet, after a period of fasting or following severe illnesses, patient may transition to a cold liquid diet to gradually reintroduce nutrients without overwhelming the digestive system. Sa acute illness, patients experiencing acute infections or illnesses such as flu, severe sore throat may be advised to maintain hydration and comfort. So here are the characteristics for the cold liquid diets. For the feature of its consistency, it must be clear in liquid. On its residue, minimize the presence of undigested food particles, while on its caloric value variable from 300 to 800 calories per day. Sa protein and fat, low protein and fat. It must be low protein and fat. Sa digestibility, it must be highly digestible. On duration, it must be short terms, 24 hours to 7 days.
Good day, I am Yusuf Imam. So I will discussing about food and fluid allowed and food and fluid not allowed. So food and fluid allowed is food give us energy to life and flow. Fluids like water keep your body working right. And about naman sa food and fluid na allowed is fuel your body with the right nutrients for energy and make water your go-to for hydration and also like health. And food and fluid na allowed, it means you cannot mention actual food or drinks. So you have to talk about nutrition and hydration in a general or abstract way. But food and fluid allowed, it means you talk about the specific food and drinks and the benefits they provide. So that's all.
Nutritional composition. So nutrients like carbohydrates, protein, fat, vitamins, and minerals. Sa carbohydrates, the quantity that must be eaten by the patient is 150 to 200 grams per day, primarily from juices, broths, and liquid carbohydrates like gelatin. Sa protein naman ma'am, 30 to 50 grams per day, minimal protein shakes, liquid sources such as oils and broths, or creamy soups. Sa fats naman, 10 to 20 gram per day, minimal, primarily from liquid sources such as oil in broths or cream in soups. Sa vitamins and minerals, aims for adequate fluid intake to prevent dehydrations. Vitamins A, C, D, and vitamin B12 as well as electrolytes. So here are the advantages of the cold and liquid diet. So it is easy to swallow, reducing discomfort to the patient. It helps maintain hydration and can be soothing to the inflamed throat. Useful preparation for diagnostic tests.
Good day everyone, I am Kapangpangan Juma and I will discuss the disadvantage and sample cold liquid diet. A cold liquid diet is a kind of diet that includes only cold drinks and food that turn into a liquid is given to a patient who cannot eat solid food like after surgery or when they have problems in the mouth, throat, or stomach. It helps the patient stay hydrated and gives the body time to rest. But this diet also has some disadvantage. It is give only a small amount of nutrients so the patient may feel weak and hungry. Some people may have also stomach pain or feel bloated. It should not because for a long time because the body needs more nutrients from the solid food. Thank you. A simple cold liquid diet includes cold water, fruit juice like apple, grape juice, iced tea, clear soup, gelatin, popsicles, and milkshake. If allowed the doctor, these are the easy to drink and help the patient stay strong and refreshed. And a short cold liquid diet is good for patients for a short time, but it should not too long because it lacks enough nutrients. And that's all. Thank you.
Good day everyone. I'm Jasmine Opino. My assigned topic is special consideration and transitioning to next diet. So number one is special consideration. It's giving extra care or attention to patient. Specific need or condition. For example, is a person with high blood pressure need food with salt. That's special consideration. And number two, transitioning to next diet. It means slowly changing the patient of food from one kind to another as they get better. For example, is after being sick, the patient first drink clear soup, uh, then soft, soft food like porridge, then later eat regular meals. That transitioning to next diet.
Assalamualaikum and good day, ma'am. My assigned topic is nursing instruction for cold liquid diet. Assessment. Evaluate the patient's ability to swallow and tolerate liquids. Monitor for sign of aspiration. Check for allergies or sensitivities to any of the allowed foods. Second is implementation. Provide a variety of clear or liquid foods that are cold, such as ice water, fruit juice, gelatin, ice pops, and flavor ice. Offer small, frequent feedings to prevent overwhelming the patients. Ensure the patient is in an upright position during feeding to minimize the risk of shocking. Third is education. Instruct the patients and family on the purpose of the diet. Advise on what food are allowed and are not allowed. Teach signs of intoleration or intolerance and when the sick help. And fourth is monitoring. Track the patient intake and output. Observe for any sign of discomfort during noisy or vomiting. Monitor electrolytes if the diet is prolonged. The second is clinical example. A patient who has undergone tonsillectomy is typically prescribed a cold liquid diet to minimize pain and swelling in the throat, prevent irritation of the surgical sites, reduce the risk bleeding. This case, the nursing instruction will focus on ensuring the patient receive adequate hydration, administering pain medication as prescribed, monitoring for any sign of bleeding for infection. Thank you. That's all.